Patients that come in and say, I can't breathe through my nose. It's our job to figure out why they can't breathe through the nose. It could be a nasal valve issue, it could be a turbinate issue, it could be a chronic sinusitis issue, it could be nasal polyps. Patients that have drainage, doc, this postnasal drainage or this postnasal drip is driving me crazy. Well, we have to go through our algorithm to understand why the nose is running, why the nose doesn't work, why when they lay down at night, their nose stops up and they can't sleep and they turn side to side all night long. They get poor sleep, it's not restorative. We got to figure out why that is, which then allows us to say, hey, it's your inferior turbinates. They swell when you lay down, that's why you can't breathe. Flonase hasn't worked. Other nasal steroids haven't worked. They're a good candidate for an in-office turbinoplasty. We use coblation technology and it shrinks the turbinate from the inside, preserves the surface, they still get the physiology, the turbinates are smaller, they lay down at night and they can breathe and they're happy. If it's a nasal valve issue, we can offer them Vivere. And Vivere is a great option for people with nasal valve collapse, which does get to be a little bit more common as you get older, but we can also treat the turbinates, we can treat the nasal septal swell bodies with that as well. If someone's got an issue with a runny nose, we can use Clarifix, and it treats the posterior nasal nerve and it reduces the innervation of those inferior terminates that are just constantly making this mucus that drives people crazy. The nose still makes mucus to carry out its normal physiology, but it's not excess, and so patients aren't bothered by that. So we've got lots of options depending on what the patient's complaint is, what the pathology is, and where in the nose it's taking place, and we can address that. Patients that have limited sinus disease, we can treat that in the office. Balloon sinuplasty has been around for a long time, since 2005. And so we've had opportunities to treat patients with sinus disease in the office using balloon dilation technology. Now we've got the opportunity to dilate the eustachian tube in patients who have eustachian tube dysfunction. We can dilate the eustachian tube in the office, and we've had some experience with that. And it's effective, given the right patient selection.